Hi, welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is purely for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is Molluscum Contagiosum and how this can be managed at home. Molluscum Contagiosum is a benign skin infection that causes spots on the skin. Although it can occur in any age group, it is more common in children. Molluscum contagiosum may only cause a rash on the skin without any other symptoms. It is caused by a virus called pox virus. Molluscum lesions are flesh-colored, dome-shaped papules with central dimpling. These can measure anywhere from 1 mm to 1 cm. They can occur in crops of up to 20 spots. The spots of Molluscum contagiosum can be found anywhere on the body, although they are rare on the palms and on mucous membranes. These spots are usually harmless and should not cause any associated health issues. Any individual lesion may last a couple of months, but it can take up to 18 months for complete clearance of the lesions without needing treatment. Occasionally, there could just be one lesion, but multiple lesions are more common. Eczema sufferers can have hundreds of mollusca or lesions, due to problems with normal barrier of the skin. Once the lesions have cleared, they do not usually come back. Molluscum contagiosum is contagious and it can be passed on by direct skin-to-skin contact. However, there is no need to stop normal daily activities. If there is dry and itchy skin with the spots, using an unperfumed moisturizer, having cool baths, and holding a damp towel against the skin could help. For adults, using a condom during sexual intercourse can prevent the spread of the infection to others. It is best to not share baths, bedding, towels and clothes. The spots or lesions should not be scratched or squeezed as this can lead to secondary infection. For symptomatic spots, Molludab 5% potassium hydroxide is available over the counter. It can be applied to each individual lesion or all over the affected area with a cotton bud or with the applicator. Steroid cream for itchy and irritated skin, and a course of antibiotics for infected spots can be considered if needed. If hydrocortisone is used, this should not be applied for more than 7 days at a time as it can thin the skin. Cryotherapy or freezing with liquid nitrogen and surgical excision are other options for more resistant cases. If there is uncertainty about the diagnosis of a rash or if there are lesions close to the eyes, it is advisable to see a doctor in person.